Assalamu alaikum everybody. I am Dr. Maliha and we are here today on the Health Talk with a very renowned psychiatrist, Dr. Mowadat Rana. Assalamu alaikum, Dr. Mowadat Rana. How are you?
Ji, I'm fine. Walaikum assalam.
Dr. Mowadat Rana, please tell us a little bit about yourself.
Ji, I'm a professor of psychiatry and behavioral sciences. I formerly served as the advisor in psychiatry in the armed forces and was the founding commandant of Armed Forces Institute of Mental Health. I served at Army Medical College as professor of psychiatry and head of psychiatry there. Was dean of psychiatry at College of Physician Surgeons for a decade or so. I started my career as a medical student from the first batch of Army Medical College, and then came out as a gold medalist graduate from there. And since then, I joined psychiatry in 1984, which is a long time ago now. And these days, I sort of go around teaching about behavioral sciences and various aspects of mental health, regarding promotion of mental health, prevention of mental illness, and I do private practice in the evenings. That's generally my profile.
Thank you so much, Dr. Mowadat Rana. My first question to you is, according to you, what do you believe is mental health?
Well, you see, the first and the most important part of good mental health, or positive mental health, is personal contentment.
Mm-hmm.
That a person who's mentally healthy is contented with who he or she is. And that's a very, very important starting point and sets the tone for everything that follows. The second part of a person who's mentally healthy is that he's not only content with himself, he also feels responsible to the society that he or she lives in.
Definitely.
And then, of course, to have both these things, one needs a bit of economic emancipation, that he doesn't feel dependent in any way on anyone, and at best is into a state of interdependence, but not in a state of dependence economically.
So
he's making
what would the
a
difference
contribution.
be between interdependence and not complete dependence?
You see, complete dependence is what often we are as children,
Right.
And when we are young adults, we grow out of that role, and we become we remain emotionally dependent somewhat, but economically we are able to sustain ourselves and make a contribution towards others as well.
So Dr. Mowadat Rana,
And the last part
sorry.
of the definition that you had asked is occupational effectiveness. It's very, very important for human beings to be skilled in life to remain mentally healthy. There's a lot of studies to show that people who are skilled in something tend to be far more healthier mentally than those people who do not have any skills whatsoever. And these skills are not about only psychomotor skills. It's all about life skills also. So you have effective communication skills, you have effective social skills, you have skills to control your emotions. So a degree of occupational and skilled state effectiveness is also the part of what we would consider positive mental health.
So what would you consider a good mental health or optimum mental health in a relationship like an institution of marriage, where two people are somewhat in some way or the other emotionally dependent on each other?
Well, in a marriage or in people who decide to live together for a long period of time in their lives, I see marriage as a social institution. It's not between two people only. It's like family is a social institution. Similarly, marriage is also a social institution. So it is not about just two people deciding to live together. That's living together, okay. Cohabitation maybe. But marriage has to be seen as an institution. And the essential components or the building blocks of it obviously start with a degree of attraction and compatibility between two people.
Mm-hmm.
That attraction and compatibility then combines to generate a degree of friendship between them. That they
Yes.
they feel that they're friends also at a certain level. They feel attracted and they are compatible with each other, but they're also friends. Friends who not only are friends in terms of communication or in terms of views of life, they also love each other. So a degree of
Yes.
love is very important component, in my opinion, uh, in uh, in the institution of marriage. But most importantly, and probably the cementing block or the cementing part of marriage in terms of its relationship, on which I think all these building blocks stand, or the, let's say, the founding stone of marriage, I think, is respect. So
Definitely.
these to me are the four components that makes a beautiful marriage.
So, speaking about motor skills, my next question is, how can poor mental health uh, have an effect on the brain, scientifically speaking?
But what happens to you're talking about poor skills as in
As
what context?
in an institution of whatever relationship we can talk about socially, if somebody has poor mental health as a result of trauma or a toxic relationship, how can
Mhm.
that take a toll on the brain?
Well, the first thing that happens with poor mental health is that this person can uh, start to become fearful and apprehensive. So, all those normal human emotions of sadness, of fear, of anger, of gloom, of excitement, of
Yeah.
happiness, all these normal, regular human emotions, the normal thought processes of, you know, uh, thinking in abstract terms about things, also the normal functioning in terms of the awareness of one's surroundings, all these other four components of mental health that I was talking about. Suddenly, when there's poor mental health, everything goes in a disarray. The emotions are all over the place. So one is either excessively fearful or starts to take risks and become completely fearless,
Hmm.
becomes so gloomy that life seems a doomsday scenario all the time, and you're living constantly in a state of doom and gloom. You don't want to live anymore, or you are extraordinarily happy for nothing, and the excitement that you have is morbid.
Right.
Or you become paranoid. You
Hmm.
start to think that others are against you and they're plotting against you. Or you become jealous of other people. You become lustful. That
Hmm.
means that you don't really give a damn about anybody else's needs and desires. You just are so greedy that you want to engulf everything around you, or swallow everything in terms of relationships or resources around you. So the positive mental health versus poor mental health actually are exact opposites. So everything that we earlier talked about, positive mental health, gets reversed. So you become personally discontent, you become socially irresponsible, you become occupationally ineffective, and you become dependent on other people in various ways in life. So your entire functioning, both at the biological level as well as at the psychological level, and then of course at a social level, goes for a six.
Right. So, Dr. Madhit, how would you encompass all the mental health conditions that we have in our society? How would you, characterize which ones are very common in incidents in Pakistan, in amongst children, amongst women, amongst men, in all walks of life? What are the most common social issues in Pakistan today?
I think foremost what we need to highlight is that individual mental health
Yes,
is is reflective in the family. The family's mental health is reflective in a community, and the
right.
community's mental health is reflective in the nation. And then the nation's mental health starts to reflect in the global village that we live in. So the building block of the entire mental health process, or the brick with which the word is basically built, are individuals. Our word is built around individuals. So the starting point is the deterioration or goodness of mental health of an individual, but then it starts to reflect eventually in the global village. So it's very important to see the link between individual mental health and what is happening to the world around you at the end of the day. So we need to start to look at the concept of mental health in a slightly different way than we look at the physical health of an individual. Suppose a person has TB, and or has diabetes or hypertension or coronary artery disease, he may remain unreflected into the global village's state of physical health. One man's coronary artery disease would not reflect into the coronary artery disease of the entire world, so to say, in symbolic terms. But the sadness and gloom, the paranoia of an individual, or the psychosis of an individual,
Yes.
or the social irresponsibility of an individual is going to reflect in the family. It is going to then reflect in the mahalla, the community in which this mahalla is. And slowly but surely it will permeate into the global mental health state. So I think that's a very, very important theme to carry. At an individual level, however, developmentally speaking, the young children often suffer from neurodevelopmental disorders like autism and
Yes.
ADHD. They also suffer from emotional disorders of anxiety and depression. They sometimes also suffer from conduct disorders where they are all over the place. They are disruptive and angry and destructive. And they do these, silly little childlike crimes and set things on fire and
Yes.
become extremely disruptive. So those kind of behaviors, and rarely they also develop habits like stammering and stuttering, learning difficulties, and difficulty in control of urine and control of their stool habits. So those are those early childhood or children and adolescent issues. Then, of course, as you grow up and you become an adolescent, then the high risk for the onset of schizophrenia, the onset of bipolar disorders, usually in mid-adolescence or later adolescence. And
Hmm.
of course, drug abuse is one of the major issues when it comes to adolescence is concerned. As you grow up then and you become a young adult and a responsible adult of the society, depression becomes exceedingly more common, both in men and women.
Yes.
And in the later years of life, um, you can start to develop conditions like dementia, which can start sometimes pre-senile or sometimes after the age of 65, alongside various kinds of hormonal disturbances like females develop postmenopausal syndrome,
Hmm.
a lot of anxieties during the period of menarche. Uh, Common disorders also include obsessive compulsive disorders amongst more commonly amongst females, at least 3 times more common than males. Amongst the psychoses, uh, it's usually about 2 to 4% of population that can experience in their lifetime of state of psychosis. The two most common are schizophrenia and bipolar disorder. Very rarely, people also develop conditions which are related to drug abuse or consequent to drug abuse, use developing schizophreniform or mood disorders consequent to drug abuse. And even rarer than that are what we call the personality disorders, which then can lead to some behavior which is totally responsible towards the society. So those are the general scheme of things as far as psychiatric disorders are concerned.
Uh, right. Dr. Mowadat, I have this question that I really want your opinion on. Is it a misconception or is it true that the younger generation today face anxiety and depression more commonly than previous generations before us?
Well, you see, I think the patterns of anxiety are different. Anxiety and depression has been prevalent, I think, for as long as I can look back.
Right.
Um, It's just that there is the types of anxieties that people now experience, and the degree of depression, the patterns of depression and patterns of symptoms that you experience, they have changed. And naturally, the social coloring to our symptoms come from our environment and learning processes. So I think it's not fair to say that our generation today is more anxious than ever before. I've heard that sentence for the last 40 years, so that couldn't be true. So when I started psychiatry, I heard the same sentence: the new generation is more anxious than the previous one.
Yes.
But then today, so obviously I've passed through two generations at least, so it cannot be true
Right.
that yes, what has happened is that in the meantime, a lot of people have become aware about their anxiety disorders and depressive disorders, which were usually brushed aside as reactions to the situation in life. In one situation, we've always thought, which is so unfortunate and unfair actually, and just tells us how little we know about psychiatric disorders, that we've always thought that psychiatric disorders are some kind of a reaction to life's experiences.
Yes.
Whereas diabetes is a disease that you get, depression is a reaction that you face if you have a loss in life, if
Hmm.
you've gone into a divorce, if you lost somebody in life, or there's been a setback, emotional or economic. Only then you are entitled to depression. So if you came to me and said, डॉक्टर साहब आप बड़े उदास लग रहे हैं, आपको क्या हो गया, कुछ हो गया आपकी जिंदगी में, so you'd immediately ask for something which is environmental. So
Hmm.
we've always thought that psychiatric disorders are probably more like infections
Hmm.
that occur because of bugs. Bugs here are social factors, and whereas our other lifestyle disorders like coronary artery disease or diabetes, you'd never ask this question, क्या हो गया आपको, heart attack हो गया,
Hmm.
except in movies of course. फिल्मों में होता है कि वो दिल टूट गया तो उसके साथ ही हार्ट अटैक भी हो गया,
Hmm.
बच्चे ने अपनी मर्जी से शादी कर ली तो अब्बा को हार्ट अटैक हो गया,
Hmm.
so those kind of things. Yes, बेटी का रिश्ता नहीं आ रहा तो अम्मा को हार्ट अटैक हो गया. But other than that, in real life, you would never ask those questions. So that's more out of misconception and myth about psychiatry.
Right. Dr. Mowadat, how can one gauge that they are mentally unfit or unwell and would require psychological or psychiatric assistance?
Sorry, I didn't get exactly what the question is.
Yes, I'll explain. So my question is, how would one gauge if they are mentally unwell or unfit and
Okay,
require, yeah,
mental. Okay,
psychiatric or psychological assistance?
okay. I said that's a very, very important question. Well, the first thing is that we need to understand that the brain is the organ that tells us about the fact or makes a judgment that any part of the body is ill. For example, if I have a kidney issue, my brain will tell me that there's something wrong and there are a set of symptoms that will be appreciated by the brain. If
Yes.
there's a heart condition, my brain will tell me through various kinds of interpretations and judgments made by it that this could be a heart condition. Now, it's very, very ironic that once the brain starts to break down, heart cannot return the favor, or kidneys cannot return the favor and tell the brain, look, this time it is you which is unwell. So it's so ironic that when the brain falls ill, there's nobody to tell it except the brain of other people around you. So I
Yeah.
think it's very important to understand that when we fall ill, largely in terms of falling ill, in terms of our cognitions, in terms of thinking processes, mood disturbances, in terms of our judgments that we make, it is people around us who are likely to tell us there's something gone wrong with you. So we need to look into the mirror of other people, the relationships that we have around us, who would be able to tell us about our mental health far more effectively than us. So that is the reason the human bonding is so important. Human relationships are so important, and that you trust in the people around you, and the people around you then can tell you that you're not feeling very well. We, on the other hand, feel stigmatized. Even if
Hmm.
I'm a psychiatrist and you tell me there's something mentally wrong with you, I'd feel horrible about it.
Hmm.
And and I'd say, oh my God, she's judging me, I would say. you
Hmm.
know so we feel very bad about people telling us you're not very well. Probably the way we tell people also is sometimes derogatory and judgmental. So, so it's very important, first of all, to understand this fact that a brain which has gone bad or unwell will not be able to tell you that you are unwell. The second part is that you need to look at your biological functions, day to day sleep patterns, eating patterns, your libidinal patterns, your changes in weight, your personal hygiene, the way you look after yourself. So your routine biological functioning as a human being is going to be affected with mental illness. The second issue is that suddenly your social functioning is also going to go wrong. You know, you would not be as good a son as you used to be, or as good a daughter or husband or wife or whatever you have. uh, then your employers are going to start to feel also this change in you. So you'll not be occupationally as well as you used to be, or not uh, functioning as well at work as you used to be. And people around you at work would say, "आपको क्या हुआ है? कुछ गड़बड़ है? आपकी तबीयत ठीक नहीं लग रही." You're not. So you're making mistakes. You're making silly mistakes. Your concentration lapses. You're not performing to your optimum best. So those are the areas around which you would find changes, and it would mean that mental health has gone bad. Last of all, there are changes in our mood, in our appearance, in our dressing, in our speech patterns. We stop making sense. We start to talk irrelevant and bizarre and sometimes nonsensical stuff. Our moods change, and we tend to look far more pensive or sad or gloomy for nothing. There's nothing around us to explain that kind of pensiveness, or that degree of sadness that you're experiencing. One might also look lost most of the time, and staring into thin air for nothing. And that means that there's something wrong.
Right. And according to you, what would you believe are some of the common cures for mental health diseases that we find today?
See, the cures was probably a very strong term to use for any disorder. We often do not have cures. There are methods that mental health interventions
Yes, or therapy.
suggest, and those are methods of managing most of the situations. I
Right,
wouldn't I wouldn't probably use the word cure.
right.
So there are some good management strategies. Uh, Pharmacological interventions are probably the strongest that we have right now. There are very good antidepressants, antipsychotic drugs, anti-anxiety drugs. Now there are drugs also available to look after one's concentration and attention spans. There are drugs now also available to actually reduce the pace at which deterioration of cognitive functions in dementia is taking place. So that can be slowed down somewhat, if not reversed totally. Then there are mood stabilizers that we have now. So they kind of tend to stabilize one's moods to a degree. Then are psychosocial interventions. And psychosocial interventions take various shapes and forms, starting from counseling, where you are largely trying to provide or helping people help themselves rather than give them mashwara or advice.
Hmm.
And then, of course, are a series and large number of therapies. Some of them are evidence-based, but there are several others that are more flash in the pan, just the fad of the day, or because you've read about it in the Google. So one has to be very careful that a therapy which is not evidence-based can do more harm than good, just like a drug can do more harm than good if you're using it without an expert writing the prescription. So therapies are very in these days, but they can be, they're like surgical maneuvers or surgical interventions. A
Yes,
bad psychotherapeutic interaction can probably do more damage than even surgery. So one has to be very, very careful when we use the term counseling, when we use the term therapy, that it needs to be by an expert about which you have established that they have qualified from a proper institution. They have a registration with a responsible body. We have had major tragedies in this country because of unqualified people, who are now dime a dozen offering various kinds of psychotherapies. So, and they are damaging people like anything, you know. But in a country where people are going around getting bled, you know, as 100 years ago, people used to get leeches on their
Hmm.
bodies. There are, now you see them getting bled right, left, and center openly
Hmm.
uh, on roadsides. So you see, now there are psychotherapies made available to people online and in person without any true control. So it is very, very important on this forum to let people know that psychotherapy is like a surgical intervention. So, like, you would be very careful in lying down in front of a surgeon because you know that he's going to use his knife. It
Yes.
is that the tongue of the therapist is just like the knife of the surgeon. So they can be similar destruction or probably more destruction. As you know, tongues can leave wounds which are deeper than those that any knife can produce. So it's very, very important to keep that aspect in mind in terms of psychotherapeutic interventions.
Right. Lastly, Dr. Mowadat, I just wanted to ask you if you have any message today for the youth, children, women, men, on for Mental Health Day, which is
So
on,
yes,
yeah,
tomorrow,
yes,
as we speak, tomorrow is the World Mental Health Day, 10th of
on the
October,
10th of October,
celebrated.
yes,
Uh,
inshallah.
this year's theme is invest in mental health and well-being. Investing in mental health and well-being is a very, very important theme and a very well thought out theme for this year. It basically implies that you need to understand that health is a result of uh, a multiplication between mental health and well-being. That you cannot think of a healthy society which does not have a degree of well-being prevailing in the society. And this well-being that people experience is to do with various kinds of states of mind that people need to have. And the foremost component of any state of well-being starts with a state of personal happiness and joy that people need to experience. People, when they're not happy or they're unhappy for some reason, they are lesser human beings. They are not they do not operate on their full potential. So anybody who's not in a state of well-being is probably half a man or half a woman, so to say, or half a child. So to actually have you in a state of well-being means that you will truly be a citizen worth his or her name. I think that's a very important understanding to carry of well-being. Then, of course, it is through empathy to for the feelings of other people, the states that they are in, and also understand the importance and significance of living a life of ethics and aesthetics, in my opinion. To actually
Right.
live a life in which you believe in some kinds of do's and don'ts. It doesn't matter whether you're religious or not, but it is important to have some degree of do's and don'ts, or types of do's and don'ts in your life, where you feel responsible to yourself for those do's and don'ts rather than thinking that there's somebody watching you and gauging you for your do's and don'ts. That degree of responsibility within a compass, an inner compass of right and wrong that you carry all the time. That produces a certain degree of social responsibility and a state of well-being at a certain level also. But also with ethics, to believe in aesthetics, that you, wherever you are, you try to make things beautiful in your life and the life of other people. Ugliness is a disaster. And you know what my concern about human beings always is that if they do not understand the concept of beauty and ugliness, they're likely to never truly realize their potential and be a source of happiness and joy for other people. So I think aesthetics is extremely important in terms of well-being. Last but not least, in my opinion, is the importance of understanding that human beings are about interdependence and not about independence. So there is this unfortunate state which we call "Main Azad Hoon," which is a lovely movie also. People should see it. But आजाद हूँ का मतलब ये नहीं है that you live in some kind of a jungle. हम आजाद नहीं है. हमारी आजादियां एक दूसरे के साथ जुड़ी हुई हैं. You know, human beings are capable only of looking at 180 degree of this world, and it is always in pairs that human beings would do better. We need other people around us. We work best when we are in tandem and in couples. That is when we do best. And so it's very, very important that two people are interdependent on each other. They know that the best in them would be brought out by the other person around them. And similarly, they can also bring the best out of the other person. Of course, they can bring the worst out of each other also, if they want, which sometimes is the case in many relationships. So that interdependence is something very, very important as a theme to understand, that your full well-being really comes by understanding that you owe a certain responsibility to the person next to you, and that person in turn holds a responsibility towards you. And this mutuality of 180 from your side and 180 from the other side is what is going to produce the 360 degree of understanding of the world around you, which is beautiful. So I think those are my messages for people around me, and Pakistanis in particular, my own country. That
Very aptly put. Thank you so much, Dr. Mowadat Rana. That was beautiful. I think a very important message for Mental Health Day. Thank you so much for giving us your time and enlightening us on mental health. And thank you to everybody else who's watching as well. I hope that we can bring out the better in those that are around us and allow them to bring out the best in us. And thank you so much. Thank you.
My pleasure. My pleasure.
And we hope
thank you very much for giving me the opportunity.
Sorry?
I said thank you very much for giving me the opportunity to speak on this.
Thank you so much for giving us the opportunity to learn from you. And I hope that one day we also get the opportunity to interview you in person as well.
My pleasure.
Someday.
It will be my pleasure.
Thank you so much.
Take care. Thank you.
Okay.